Hello, guys. We are here outside the hospital, and it's kind of noisy, but it's the start of the day. Welcome for another episode, and I am here to discuss about the healthcare system here in America. So, if you're interested, stay tuned and roll the logo. To start with our discussion, we're gonna start with what kind of hospital we have here in America, and as I've seen in Wikipedia and on the internet, usually it is composed of private sector, and then there's a non-profit which is covered, I think, by the community, and then the other 21% is under the government. So 58 private sector, 21 from community, and the other 21 is the government. So there's a difference if you're gonna be working in a profit or a private sector, and then a non-profit. And I was able to work on both. I haven't been to a government hospital yet here. So the only difference is that the hospital, which is a non-profit, they do usually charge you um, a lot. I think it's being paid by well, most of our hospital are being paid by the insurance, right? But then there are a lot of hospital which is a non-profit that takes donations. And I just remember when I was working in a non-profit hospital, even if you're the employee, sometimes they want you to donate, from your salary. So they needed more funds to function well and to you know improve their hospital. So the last hospital that I was working before was a non-profit, and they're kind of like expanding. They have a new building that's being constructed, but it is based on donation. So that's why the hospital usually make it to a point that all the patients are really happy with their care. And then it's really surprising, because if the patient gets well and the family knows about it, or even if they expired, the family will donate millions of dollars to that hospital if they're happy with it. They know that the family know that they are their father or parents or their patients are being taken care of, even if they died. So they donate money, millions of money, for that hospital. And then the other one is the private sector, which is as usual, a business owned hospital, which has a lot of resources, because they are profit. So they try to make sure that they have income, and they get their, what do you call that, what in simple terms, I guess it's called profit, right? So the good thing about working in a private sector is that your supply is always like available all the time, unlike in a non-profit. Sometimes they kind of budgeting everything. There's all of the hospital are trying to make it to a point that you're not wasting resources, right? But the more in the non-profit, because if they ran out of it, you have to run to the other department, or to the other building, or the other floor. Let's just say the other floor, and to get stuff like the dressings, if they don't have any IVs anymore, and then the pharmacy doesn't have available that can be tubed to your place or to your floor, then you have to go and get them, or call the supervisor and get the stuff for you. So it's kind of like a hassle, to take care of patients. And you, considering that you have a lot of patients in the hospital, you have six, and some now it's a six, but before they say they have 8 patients before. So can you just imagine if you're gonna be running around just to get the stuff that you need? And then for the government hospital, I haven't, like I said, I haven't worked there yet. I will try. I want to go and apply there later on. if I can, or if if I'm able to get in, the good things that I'm hearing that the benefits there is really good. I will not confirm it, but because I don't have any experience about that one. But they say that if you have an insur or if you're working in a government hospital and you have an insurance, the insurance will cover you wherever you go. There's actually two kinds of insurance here. One is PPO. I forgot the meaning of the PPO, but the good thing about that insurance is that when you go to another state, you're covered. You don't have to have a doctor that's gonna check you. You know, you can go to other doctor in case you're in another state and you're on a vacation and you had some illness. You know, you can go to any doctor and you're covered. You don't have to worry about anything because the PPO is kind of like all over the nation, or nationwide. And before I forget, I just want to mention about the insurance. When you are working on a profit hospital or a profit facility, your retirement benefit is gonna be 401. And if you're working on a non-profit, they're based on donations. Your retirement is gonna be 403k. So 401k for private, 403k in the non-profit facility. So if you want to know about it, I do have an old video. I will put the link down here so that you can check it out. Okay, so it's about a nurse's benefits when you're working here. Okay, so moving forward, if you're going to be working here, all the things that a patient needs is actually available here. So can you just imagine, let's just say in my case, I was having some sleeping issues, and they can refer you to a sleep medicine, right? If you're a nurse and then you have a patient that has a lot of issues, you have to remember all your protocols. So for example, there's a new patient that is admitted, and the patient has a wound. During your assessment, you see it and it's not in the system, or nobody has documented it. You have to document it, and then you have to inform the wound team or the wound consult. So that's one. So let's just say primarily the patient has a medical issue, so there's a medical doctor. But then if they have another issue with regarding like GI, then they're gonna consult the GI, or a surgery if they needed a surgery. If they have to put a tube, they're gonna refer it to the IR. So there's a lot of departments here that is available in the hospital. I don't know if it's really similar to the Philippines, but here you can put anything there in the computer, documenting everything, and then you can recommend it to the doctor, call the doctor, and then they're gonna make a referral. Or you can actually put a recommendation or a referral as protocol. There are protocols here in the hospital is allowed for a nurse, and there is a protocol that only a doctor can do a referral. So like for example, if surgery, you cannot really decide on a surgery. The only person who can prove that the patient needs surgery is the doctor, so they have to discuss that one, right? But then with regards to wound consult, or even a simple loose stool, if a patient has a loose stool, and then you ask them if they had it for 3 days, then you have to check the C. diff. That's I always remember every time, especially during admission. You can put a laboratory for C. diff. In some hospital will allow you to place a laboratory referral per protocol as approved by the hospital. So you can do referrals too, so that's a good thing. So thinking about all that departments, all that referral that the patient has when he is being discharged, there's also a final instruction that is printed to the patient. It's discussed with the patient before they go. So in my previous hospital, we print a paper, and we have to check it if the patient knows what I am instructing him to do or her to do, and then you're gonna call whoever is gonna be the in charge of that patient's checkup. So they usually put like a referral, like go and do the outpatient after a week or so, and you have to call that facility that they wanted. They have to call you have to call I mean you have to call the pharmacy how to get their medication. Some patient prefers their own pharmacy. You can call the pharmacy and they can send the prescription there. And there's also an instances that we print the actual prescriptions to the patient, and they will be the one to get it. But usually it's electronic now, and we can just send it to the pharmacy, and then the patient will just go there, or the pharmacy might send the medication to them if the patient prefers. So everything is starting to be electronic now, and that's why you have to make sure that all the data is okay. Before you get the information that they're gonna actually try to ask you what's the birthday, the patient's name, to confirm that it's really the patient, So, but because of that reason, you have to be careful too. That information is really sensitive. You cannot really say it aloud, or whoever is, around you. You have to be discreet with your conversation on the phone too. And then I would like to discuss also that if the patient doesn't have a car to get them or send them home, there's also the social worker that's going to help the patient get the transportation they needed. So everything is being taken care of here. You cannot really just send the patient home and then that's it. So everything here, you have liability. You have to make sure that the patient is well. If everything's like whatever happens to the patient outside and something happened, it's gonna be your responsibility. So everything's being taken care of. The patient is at home and nobody's there. Before the patient's being discharged, it's being evaluated by the social worker if the family is willing to take care of the patient, or if the patient doesn't have a family that's gonna take care of him. So they're gonna refer the patient to another facility, not home but another facility or a rehab. So everything's being covered, and before the patient goes home, there's a plan. There's already a plan that is being made before the patient gets out of the hospital. So that's the nicest thing about the healthcare here in America. And I just remembered we have a patient also that is homeless. He doesn't have any family, and the patient cannot decide anymore. So what you gonna do with that patient? So usually the hospital has a person who's gonna decide on that case, and they're gonna recommend it to the government. So we have a patient that is being sort of like adopted by the state, something like that. I forgot the word, but it's covered by the government. So all the hospitalization, all that is needed by the patient is being taken care of the government. Okay, so there you go. That's our topic today. And I would like to add that before you work here, you have to know all the protocols that is under your jurisdiction or under your control. So there are protocols that is allowed by the hospital that you can do, and of course the doctor has to do the referrals to make the care one. Okay, before I completely end this video, I forgot about to mention about the clinics that we have here. Usually if you're gonna go to clinic, you have to make an appointment, and sometimes it takes months to be able to get a day for your clinic visit. There are actually a clinic that is gonna accept you on that day without what do you say, an appointment. It's called urgent care, but then there's a long line too. So same as in the Philippines, I guess. So just want to add that one. Thank you, and that's it. Bye bye.